I guess cheeks. You know what's under the knee? Ooh, that's a wrong place. Cheeks would be. I don't want to.
1 2. Test 1 2. Test 1 1 1 2. One two. 1 2. Test 1 2. Test 1 2. Test 1. Test 1 1 1 1 2. 1 2. Test 1 1 1 2. Test 1. 1 2. 1 2 3.
Testing 1 2 1 2 test 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 1 2. Hello, ladies and gentlemen. We are going to Las Vegas today. Test 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 1 2 1 2 test 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 1 2 1 2 test 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 1 2 1 2. Hello, ladies and gentlemen. This is your captain speaking. We will be going to Las Vegas today. It'll be a roughly 2 hour and 30-minute flight. So please sit in your seats comfortably and enjoy the ride. Test 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 1 2 1 2 test test 1 2 1 2. We'll be taxiing down runway 43 to runway 212, where we will be taking off. From there, we have a gust to the right of 3 knots and a
1 2 1 2 1 1 1 1 1 2 1 2 1 2 1 2 1 2 1 2 1 2. Go ahead.
testing 1 2 1 2 1 2 1 2 1 2. Test 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 1 2 1 2 test 1 2 1 2 test 1 2
Let's go
1
and
test.
test this. All right. Testing. Testing headset. 1 2 1 2 3 1 2 3 4.
Testing headset 1 2. Testing mic 1 2 1 2 1 2 1 2 3 4.
Testing 1 2 1 2 3. Test 1 2 3. 1 2 1 2 3 1 2 3 1 2 1 2. Don't worry about the phones. That's a small problem. And then here's your.
Oh, here it is. Let me look and see.
Oh, that's what I'll do. 1 2 3 1 2 3 1 2 1 2. Great. So it's called an eCam at your feet, and then again, once I go, once I turn this around,
Wait, is that? Wait, that's early proof. Is it? Yeah, I see that. That's good. If you want to go later, we can too. It's no big deal.
grab this.
No, they're working in the morning. Not me. I wonder. I'm opening the schedule to see what things look like for tomorrow. Oh, we're
Should
closed all morning. Yeah.
should find
Yeah, we're opening at noon. Yeah. Here, but my PA is working over there in the morning. Yeah. Well, yeah. Why don't you just come in at like 9:30 or something? We can do that. Yeah, because I didn't realize we were working here. I mean, I'll probably be here either way, but because it's crazy, we have a lot of work to do here, cleaning things up, and I have a lot of other stuff over there. So yeah, dude.
So I won't find this. What else can I get you?
All right. Well, let's do it. Okay. Oh, hey. How's it going? Thanks. Yeah, this is like we're doing a demo.
MeiRai
Yeah.
live.
What can I do? We got. I guess. I said I'm not gonna round people up. I'm not gonna like go to yell. So but it's on the TV. So it will be on the TV in a moment.
Well, it already is on.
Oh, it is.
Should we wave? Not yet. We have
Serena.
Welcome, welcome. We're just going through neuromodulator through Botox, Dysport particularly. Yeah. Since we love Dysport.
Jane, let me
There's
make
our
sure
Dysport rep.
make sure your
Good.
tack's on.
Yeah. Uh-huh.
I'm gonna pull your tack out real fast.
Yeah, go for it.
Okay. And perfect. Put it back in there.
You guys come on around so you can see. All right, guys, welcome. So we do this usually every year, talking a little bit about neuromodulator, also known as, which is a name for botulinum A toxin, which is a chemical, sort of like a poison in nature that we've learned to use for really positive effects in other places, but particularly today for aesthetic purposes. And when you inject botulinum A into the face, it weakens muscles temporarily, usually about 3 to 4 months. And so we wanted to run through some of the more basic conventional uses, and then maybe some of the more advanced ways of using the Botox in those, and I'll just call it Botox for now, in those conventional uses. And then we wanted to also talk, what we usually do is talk about some less common or more popular or more advanced ways of using it as well. Because there's like hundreds of ways to use it that we don't even do, that people come up with. It's kind of funny. But for this one, normally I do the injections, but I'm gonna have my nurse Peyton do the injections. I'll put her on the spot, and that way I get to talk and do some of the drawing on the face too, because I want to draw things out. So first of all, the most popular places, the three most popular places are the forehead, or the frontalis muscle, the crow's feet, or the orbicularis oculi muscle, which goes around the eyes, and then the glabella, which is the frown lines between the eyes, which is made up of two muscles that you're injecting, and those are the corrugator and procerus muscles. And so why don't we start out then with the glabella, because I think that is the frown lines. It's like the most popular area to do by far. And so those two muscles are the procerus muscle, which runs vertically, kind of like this. And then the corrugator muscles, which are going to run like this. Okay. And so you see, okay, so red is corrugator. So the corrugator is going to kind of pull this way and is more responsible for making those 11 shaped frown lines that we have. And the interesting thing about the corrugator that's important to know anatomically is that it starts over here. It's called the origin. It attaches on the bone really deep here. And then as it comes across over the eye, it gets more and more superficial and it attaches to the skin. And well, that's cool. Why is that important? Okay. Well, the reason it's important is that if you plunge the needle deep out here, you're going to miss the muscle entirely. You're going to go back, down to the bone or go into the fatty tissue, and you're not going to be really targeting the muscle. Okay. If you hit down deep in the middle here where it attaches on the bone, you're going to be delivering the most dysport or whatever else to the area where it's most effective. Okay, so by knowing the depth of the muscle at different places, we can get the best effect for you guys, the longest effect and the most potent effect. Okay, and so and the same thing with this procerus muscle, which pulls vertically and gives sort of like wrinkle your nose. Yeah, so it kind of pulls things down, and so that's the procerus muscles. There's this bulge here, so it attaches down in here as well. So that's those two muscles of the glabella. So Hayden, my beautiful assistant, is going. Oh boy, is going to do the injecting now.
My assistant.
She didn't like that. So she's going down deep there. And right down in there. So that's procerus. Good. Okay. So next is the frontalis muscle. Frontalis muscle is like a sheet-like muscle, which it actually sort of interdigitates with these other muscles we just talked about. And that's like a sort of a sheet-like muscle that goes up into here. So it helps you raise your brow. So raise up hard. Yep. And so I'm going to make some little marks in here. Okay, I'm going to stay high in this case. We don't want to go, in general, we don't go too low, because if you go too low, this is the muscle that raises your brows. So you risk dropping the brows, making your brows heavy, making yourself look more tired. No one wants to look more tired. The whole reason you're here is because you want to look younger and more awake, right? So we keep high most of the time. So I'm going to do this one. One of the things we've started doing, some gloves
Just the
on.
one that you did.
You want to do it?
No,
Or
you
I'm
did.
good, yeah.
Is it the 10?
Yes. Yeah, it just has 10, yeah. One of the things we started doing is using a concentrate of Dysport, and so we're using half the liquid. So you're delivering a twice twice as concentrated version of this neuromodulator. And when it's more concentrated, it's going to move and migrate less. It's going to stay in place and affect the muscle there only. So we've been having really good results in not, the biggest thing, and I always tell Peyton, fear the forehead. Yeah, because like probably the number one callback in Medi-spas is for heavy brows or problems with injecting the forehead. It's like the biggest problem to have, heavy brows. So we've been doing this a little differently with the concentrate, and we've been having some really good results with it. But it is very concentrated. So yeah, the normal concentrate is 2 to 1. Do you have to leave the room for that?
Nope,
Or is that?
not that
Because it's off label.
Go ahead, yes, that's fine. Yeah, admire me.
Clean it forward. Yeah. Okay.
That's good.
She's bleeding a little bit. Yeah, just a little bit. Okay. All right.
Good one.
This is her first time ever getting injected with anything.
Ever.
Yeah. With anything at all. Yeah. Yeah. Okay. So orbicularis oculi. So these are these muscles that go around the eyes. All right. So now think about orbicularis oculi. So different parts act on the structures around the eyes in different ways. So the upper outer quadrant over here, this area, will actually pull the brow down. So a lot of you have heard of the spa brow lift or chemical brow lift or whatever you can call that. And so if we put a little bit of neurotoxin right up here at the corner of the brow, we can weaken the pulling down effect and raise the brow. It's important to know that Botox does not raise anything, okay? It weakens muscles, so it can sort of raise things by weakening the muscles that pull down. And when we talk about the lower face, we'll talk about another way it does that. So this muscle is also very superficial. It attaches directly to the skin, right below the skin. So when we do our injections, we're very careful to make it very, very superficial. That also keeps us out of trouble with hitting blood vessels and giving you guys a bruise, because there's always like a plexus of veins right out here that always gets bruised. But if you keep right below the skin, you can avoid that and not bruise. So we're going to give for a pretty moderate amount, 7.5 equivalent units per side. And so we're just going to give a brow lift and then 2 other injections. Okay.
3 other injections.
Three per side. Well, you're doing.
Brow and then 7.5.
Yeah. Oh, it's okay. 10. All right. I stand corrected. So those are the 3 main areas, the standard areas that are typically sort of the FDA approved areas. So you see how when she does that, you get like a little wheel. It almost looks like a mosquito bite, and that shows that she's doing it right, that she's doing it superficially enough. So let's see, other muscles.
No, I think we're just doing Nefertiti.
We're doing that. Yeah,
Yeah,
I was
like
going to talk
that's-
about
oh.
other upper face muscles. So like there's this little muscle up here called the nasalis, and if you wrinkle your nose, bunny lines. Okay, those are bunny lines. So you can put a little Botox in there and numb those. We're not going to do all these, but I was going to show you guys some other alternative muscles that you can do. There's a muscle called you probably all heard of TMJ. Okay, TMJ injections, and those little overlap with TMJ injections and migraine injections as well. But there's three muscles of what we call mastication. Mastication is chewing. Okay, so there's actually four of them, but three that help you close your mouth and bite down are the masseter, which is like basically goes from about here, hangs down, wraps around the jaw. Okay, hangs off this zygomatic arch, wraps around the jaw. That's the most powerful muscle in the body, and you can put 20 milligrams per side, right about there, and that will help with the pain of TMJ, clenching, and so 20 units per side. Now, so it helps out with pain. It can help out with migraines. A neat thing also is that if you inject it repetitively, you can actually shrink the muscle, which is really helpful in people also that clench a lot because they get these chipmunk cheeks. So the muscles get really hypertrophied from being worked out all the time. So you can actually, with repetitive injections, you can slim the face. You can change the shape of the face and change it from being sort of boxy and square to more tapered, like the aesthetic way that it should look. There's this muscle like I was talking about too, this temporalis muscle, which is a fan-shaped muscle which goes up and attaches the jawline. It's the one that when you're in your temples here, when you bite down, you can feel it bulge. So we put usually it's 15 and 15 units. So all four of those together are 70 units, a pretty hefty amount. But if you like it, you like it. And it's given a lot of our patients a lot of relief from the pain of TMJ. An interesting thing about that is if you were to inject the masseter only and leave the temporalis alone, the temporalis is basically doing like most of the work in chewing, and it'll get bigger. It'll get bigger, and so you slim out the face down here, you widen it up here, you can resculpt the face from doing that. So, all right. And we'll do the one that's super popular is called the Nefertiti lift injection. Once again, we call it a lift. Botox never lifts, but what we're doing with the Nefertiti is that there's this muscle. Being a head and neck surgeon, I see it all the time. It's called the platysma. Okay, and so it's the bacon in farm animals. It's like that. It's the muscle that runs right below the skin in the fat. And that's how like a horse can twitch their tail. We don't have a platysma over our entire body. We only have it from about right above the jawline here, and then it kind of goes down and fans out. Well, it fans out all the way down to about right in here. But this is platysma, and the platysma pulls down this whole area here, pulls down the lower face. So by weakening the platysma, you can raise all this lower facial skin, which as we age gets jowly and loose and saggy, and you can sharpen the jawline by doing that, and you can bring up this tissue, and you can volumize the midface. And it sounds like, whoa, how does a Botox injection do that? It's pretty cool though. It does it. I didn't believe it, but it does it. And it's one of our most popular injections to do as like an add-on now. It's 10 units per side as sort of my standard way of starting things. I just kind of add 10 units per side, 20 units as an add-on, and people love it. So it really works. So we're not only injecting the platysma, we're also injecting a muscle called depressor anguli oris. It goes down from the corners of the mouth here, more or less like this. It's a fan-shaped muscle, and pulls the corner of the mouth down. It's AKA the resting bitch face muscle that social media made up. So it pulls the corner of the mouth down, and by releasing it, you are lifting the corners of the mouth, getting a more passively happy face, and helping with your jowling. So pain's gonna do it. Sounds okay. You, in addition to doing just the standard Nefertiti, is it's four injections below the corner of the mouth and then across the jawline. But like the full real Nefertiti, you actually continue the injections down and hit the platysma further down, where as you age, you can get these platysmal bands along here, and you can inject those, and it lifts more and it softens the bands too, so you don't get as much of that webbed appearance. You can inject in the midline for that sort of crepey looking orange peel chin. That's about 6 units to do that. You can, I think I mentioned the platysmal bands. You can do the gummy smile injection, which will, when people smile, their lip goes up, and you can weaken the muscle. Levator labii superioris aliquinasi is the name of the muscle, and you can and nasalis as well. And you can weaken that muscle and bring the lip down so you don't have as gummy of a smile when you smile too. So, and those are the main ones. So, yeah. So that's it.
Oh, we didn't do a lip flip.
Ooh, the lip flip. Yeah. Orbicularis oris muscle. So, yeah. You want to do a lip flip?
Do you want to do a lip flip?
Let's do a lip flip. Yeah.
Not this far.
So the orbicularis is a circular muscle, like a sphincter is a circular muscle that closes. And so if you're weakening the muscle, you're going to be opening, and the muscle will sort of roll the lip around. So it'll actually, by weakening it, you roll the lip out a little bit. It also will shorten this area up in here. This area from the bottom of the nose to the upper lip is called the ergatrid, and it will actually shorten that area by rolling the lip up too. There's 2 variations to it. You can go right above the vermilion border, and usually we just deliver about 4 units. You can also go a little higher into this white roll area, we call it, which will soften the radial lip lines, smoker lines, whatever you want to call them, lines from using a straw. So there's 2 different ways to do it, and it depends on what your needs are. So this one is the spiciest injection that you do in the face, though. The best one. All right. Any questions? That one's, yeah. That reminds you a lot. Yeah.
It wasn't bad.
All right.
Must have been it's operators.
Thanks for doing it. Thanks for putting up with it.
Now you have to walk around like that. I don't know what it looks like. Is mine like a colored like
Yeah. It's tribal paint. Yeah. All right. You want to turn up my mic? Yeah. Turn up the mic. Yeah.
Jamie, how long does it take? I'm answering questions. How long do you think this approximate time it takes to see the full effect? 2 weeks?
because I looked at her and I said, what I, yeah. I'm like, well, you don't really need much, but we'll do this. And I saw those lips and I said, those are great lips and we're going to make them amazing lips.
I'm going to bring some people in.
So, yeah.
Who wants to see a magic show?
Yeah, yeah. I like that. Okay.
Are you streaming onto any socials right now, or just okay?
You know, we're just like, we're intimate here. We're not like. So the first thing we do when we do lips is we do some numbing. And so we used to put topical numbing medication, let it sit on the lips for quite a while, and it worked okay. Didn't work great. But I ended up going back to doing dental blocks. We call them dental blocks. They're sort of like what a dentist would do, but dentists never inject from the outside. They always inject from the inside. So I kind of bumped into this way of doing things and doing a lot of Sculptra injections, because when I was injecting a Sculptra on either side of the nose, I noticed that the upper lip got profoundly numb and the rest of the face didn't. So I thought, hey, that's a great way to do it. And everyone loves it. Everyone who gets the dental block says they never want to go back, and it's such a game changer. So we'll go ahead and do that quickly. Pinch.
Can I ask you a question?
Yes, sir.
To the patients. When you think about fillers, what's the most common area that when you think about fillers? Lips. Has anybody ever seen any sort of filler applied in anything besides the lip? Cheeks, right? So they that. What about neck? Has anybody seen a neck job? Has anybody seen eyes, under eyes? This is obviously a relatively new way to start. The filler business, the filler technology has evolved, right? The key is kind of having a product that has the mobility and has the body type that can be laid superficially at depth, but also has a dynamic stretch that when the face moves, it's going to stay there. It's not going to break down. It's not going to migrate in the nodules, in the adverse reactions of the past.
All right. So we're going to lay Courtney back now. That's her sister making fun of her.
Yes, you're right. I mean, you gotta be brave. You don't control everything, right? You just gotta let it go.
All right, Courtney, I'm going to have you slide up maybe about 4 more inches or so. So you're right at the top here. All right.
Appreciate that, man.
That's good. Right there's good, yeah. Yeah, we do this from above because I do vertical injections. It's a technique called the fencing or fence post technique, which was popularized by Julie Horn, who's the world's top lip injector. She's looking a little asymmetrical. Huh. All right. And I'm going to use this filler. It's called, this is Elijah, so he's the Revance rep, and his filler is called the RHA line, which he already mentioned. One of the advantages of it is that it is extremely stretchy. It's extremely integrative, so it grows in and around and through into the tissue very nicely. But and it's probably the closest filler in a molecular sense to natural hyaluronic acid filler. Hyaluronic acid is a chemical naturally found in the body and helps the body to hold on to water. It holds about 100 times its weight in water. And so what we have in these filler syringes is like a laboratory synthesized and purified form of it that is chemically modified in some ways, because if you were to take natural hyaluronic acid and inject it into the body, it would be absorbed by the body and go away really quickly in a few days. And so the chemical process they put it through gives it the qualities that it has that make it good for use as an injectable gel, and also keep it from being preyed upon by the body. So, all right. So I chose to put in RHA2, which is the second thickest filler that they have. So it's more on the thin side, mainly because Courtney has beautiful full lips already. I wanted to add sort of an accent. I didn't want to add a whole lot of volume to her lips either. So now I always tell people, I tell everyone that after you get your lips done, you're going to have about 25 to 30% more swelling. So, you know, that it does look a little shocking for a bit, but then it goes down and it integrates and it looks really nice. So, okay. Thank you. Yeah. I like these. Yeah. Can you untangle it over there? Can you cinch it? It is? Oh, okay, thanks. Okay, helps me see. All right, so here we go. Mm-hmm. Okay, so I want you to part your lips just a slight amount. How's that, Courtney? As you can see just from like one needle stick, she's got a whole lot more definition along the border there where Cupid's bow is. Dab it. There you go.
It's okay.
Elijah, you want to add?
Yeah, I was going to ask you, Dr. Unat. You know, it's a trying to figure out how to ask this question without being offensive. Are you okay? Is everybody okay with the open dialogue? At what age? So the lips. Let's just start with the lips first, right? Studies would show that after the age of 18, we start to lose 1% of our volume collagen per year until our passing, right? But I think post-menopause, this is where it's a little, I'm just going to shoot it out there. Menopause, 20% alone, right? We're starting to see fillers kind of be placed in younger age. What is the right age demographic for a filler? I want to answer from him. I'm curious.
What is the right age demographic?
What's the right age demographic? When would you suggest a filler? I think it's
Well,
easy to say yes to.
It's different because, you know, with lips, it takes. I have it. It all depends on preference with lips because I have 18-year-old girls that come sometimes and want their lips done.
Okay.
I do a lot of lips on 20-year-olds that want it, and that's more of a preference. It's a fashion type thing. When you get to the point where you're actually losing volume in the lips, you know that it varies with the person. It can be in the 40s. You know, I have women that 50s and 60s that come and they have like virtually no lip whatsoever, and it depends on how much lip you have to start out with. So I gotta say, I don't think there's any like real rule. It's different with everyone, and then there's patient preference as well. So okay, so upper lip there. I'm gonna have you turn toward me this way, Courtney. Okay? And I've only I put 0.3 already, so like 0.3 of a milliliter, which is not really a whole lot.
How's the patient feeling?
that doesn't mean you're dying, right?
Yeah, I just it was tearing me up. I got the squeeze ball.
Yeah, guys are. Yeah, we have that.
We do.
She's taking like.
But with the blocks now,
You just wanna
I
come
mean,
on in?
it's. Yeah.
Come to the first row seat.
This is a hard one to talk during because it's so precise. Putting the filler in here, I'm kind of I'm augmenting the upper portion of the lower lip to give her volume in this area called the tubercles. Injecting slowly so that the filler can flow. And I do these vertical injections first because they give the vertical height, kind of like a buttress to the tissue to raise the vertical height. And then I come in from the side in a second, and that'll just sort of give gentle, sort of like fullness in a more of a superficial way to hydrate.
I want to answer some misconceptions real quick. This is important for me. This is what I've learned. I've become passionate about as well. And it doesn't always flow well with the doctors. A bad filler job is never the product. I really believe that. I believe selection of product and volume of product, didactics, technique, all that is in the hand of the provider. If you see a bad lip job in the community, don't be like, oh, I don't want fillers because I saw that lady with bad lips, or she looked terrible. It's not the filler. It's the provider, right? Selecting the right providers who have the education, who I like to, personally, they lean more conservatively. They're not taking you past your natural appearance. That's when it starts to look more like that duck lip. Okay, you took me past my natural look. I wanted to get back to my natural baseline of fullness. I didn't want to go past that, right? That's I always kind of say that's filler irresponsibility, right? So, with RHA, it's the most natural hyaluronic product in the market. This is the most natural filler you can have in your body right now. It's got less modification. It's the most natural long chain HA. So we know that it's naturally safe. Now it's finding the right provider that can place it in the right area and give you your youth back without taking you past that where you just don't look like yourself anymore. My sister walked in recently to a family dinner and I'm like, oh, you look bad. Like, it doesn't look good. Which tells me the patient's got to be responsible too and say, hey, I don't need it right now. I need to wait till this is worn off, right? So I think it takes a good relationship to have a good filler treatment, a good filler experience. Jamie, anything to add to that? Would you agree?
MeiRai, yeah. Yep.
Well, what about people your age? I'm not the doctor. I don't make those kinds of suggestions now. But I can tell you that I sell it if you want to buy it. I love to sell it to you.
Yeah, but can you make it so it's natural looking?
Yes.
So it's not you know, you see
We
that.
just talked
it's
about
like-
that.
Yeah,
Yeah,
that's
it's
what
like-
that is what we're doing, yeah.
That's the real place.
So I'm just gonna kind of rub things to make sure they're nice and smooth.
You want your lips. That's what you want
I
first.
want lips, yeah.
I think that Jamie can help you with that.
Yeah, I'm just kind of
Really good.
rubbing to
I would
smooth
also say
things.
that what's really great about
Make
this
sure there's no lumps, although
is they're great for
honestly with
underarm.
the RHA fillers, they're so nice and smooth and stretchy that they rarely will cause lumpiness.
So they're filler on the forehead, it's
They're-
not really
it's
down.
amazing.
Yes, crepiness in the skin, like you can eliminate. I'm doing it. I'm like, yeah. Because that's the future,
get in
right?
here?
So having a,
Sorry,
That's right.
there we are.
but I think the key is getting yourself in a journey, a skin journey, where you're like, hey, I've got a pathway to at least migrate or manage aging. I don't need it all done right now,
extricate
but I
me
want to
from
have
my
an end goal in
loops.
mind. And then once you get to that end goal, say, hey, I need to maintain it. You start. There's a great before and after this book of this woman who started her very first treatment in this facility. Awesome treatment. Like she started with, I don't know what she started with. It was like
Was that?
the CNAs later, she looked so different, but it wasn't just filler. They listed like 7 things. But her complexion was better. Like she was one complexion, which is amazing.
Well,
So the browns, the reds are all
All right.
gone. They eliminated the canvas, right?
yeah, thanks.
Yeah,
And
that
then
was
they
rough.
boosted collagen growth with energy.
I don't know.
so
What
lasers
I thought. I thought you were all extra. Oh, yeah. I guess you didn't need to do that.
All of these things without surgery over the course of 9 months. That's the journey, right? Now I'm a big fan of the journey. There's never, if you can avoid surgery.
So this is a pretty thin filler. So a lot of the volume that's there now is swelling volume. A lot of that's going to go down, and what's going to remain is that definition. So,
I'm the same way.
all right. And so now we're going to do
I'm like, I can't get like this.
some under eyes on her.
Give me some pepper, you know?
Not till the end.
Where is? Do we even have a mirror though?
No.
In the room? So I think it's over. I think it's down the hall. We'll have to go get it. Yeah. Yeah. Let's do that at the end.
Yeah, we'll do it at the end.
They look really good on you.
All right.
It's not gonna make them. You don't want your lips carrying your face.
All right. So she alcohol on her face yet?
But it's obviously way too big.
Let's do some
right?
alcohol.
So, you know, they say 30% under lip. So there's a rule of thumb for natural looking lips. It's like 30%.
Yeah, it's like, well, 40 and 60, 1 to 1.6 is sort of the natural proportion. Mm-hmm.
They're afraid of the under eyes.
Afraid of the other?
My daughter's a nurse.
Take a look at the under eyes. I'm a fan of the under eyes. I think it's so cool. He's gonna do the under eyes right now.
I have this.
Hi, how are you? Very good.
Any discount?
A little bit of RHA2 here. Thought I'd put a little bit of RHA2 deep. There's not a whole lot here though. Okay. Boy, everyone just wanted to see lips. And everything else is boring, huh? Yeah. Still attached to me? Yeah. Alright. Okay, so this is a cannula. So a cannula is a blunt needle. The whole idea is that you make a little entry hole and you pass it through, and the concept is that it steers its way around blood vessels. It's not entirely true all the time, but that way you can avoid skewering a blood vessel, and there's less of a chance of entering a blood vessel and getting a complication or causing bruising. So, little pinch. Yeah. So I'm starting out using a slightly thicker, stouter filler called RHA2. It's the one I put in the lips actually, it's a leftover. And I'm just gonna put it down deeper, and then I'm gonna layer a very thin RHA called Redensity. It's pretty much the thinnest, stretchiest filler on the market. Really, really thin. But these fillers are amazing because you can put them right under the skin, like right under the skin, and they move with the face during dynamic facial expression so well that you can't see them. And you can do things that you could never do with other fillers and not get lumps, and not like have the patient smile and see a lump. It's really a game changer. I need. You're right. Yeah. It's like a whole container of food all over the. Just can't get rattled. Alcohol? Alcohol? Oh. That's nice. Okay. I like it.
Oh, we're on the procedure. We'll inject you in a little bit.
This is more like milliliters, and so far, like 0.25, like a quarter of a syringe of this. So, yeah. Well, filler can't really change the darkness. Yeah, because as and hers is pretty subtle, but you do get like if you look more like look at me, so you got like a line in here, right? It's like a depression, and that has to do with the way there's various like very fine ligaments that are underneath the skin around the eyes, and so certain areas will be tented, and certain areas will show the effect of say like herniated fat or loose crepey skin. And so what you're doing with filler itself is you are filling the valley so as to soften the shadow. Okay, and if you look, see the thing is like filler can't get rid of the dark circles. Okay, it can if it's caused by shadow, but if it's caused by vascular congestion, like from veins in the area, the only thing that can do that is an energy treatment, say like intense pulse light or a laser, and that can to kill the hemoglobin that's under the skin. But you can see that on this side it's subtle, but on this side there's this depression here, and I fill the depression so it's smooth. So on this side she's smooth all the way across. She has a little bit of darkness here, but you can see there's a difference between the two sides. So, and I only used, I think there's a total of 0.4 so far between the two fillers I put in. Okay, so I'm going to go to the other side now. Turn this one. So I'm just putting a little bit of the more stout filler right in the corner here where there's a hollow there. Under eye hollows, you can call them.
How long will this last?
I would say up to a year. Yeah.
And the lips also?
8 to 12 months, yeah.
Yeah.
Everyone's different. Everyone can break down filler at a different rate. If you were to take virtually any other filler on the market besides Redensity and do what I'm doing right now and fan it under the skin, you'd have a big problem because you'd have a big lump there that was really noticeable. And so what I did is I fanned it right under the skin, and then I'm just taking my finger and just smoothing it out, and it just beautifully fills the area. And take some and put it up along the lateral border of the eye here. Not much. Good. That's all we need to do. Yeah, so it was a total of about 0.8 total between the two fillers per side. So per side, like 0.4, so like less than half a syringe per side. So, just want to clean her up. I was gonna have her clean you up a little bit, yeah. And we need to show her, so I think I know where it is. I'll get it.
Now they're gonna move. But,
Really?
Oh, thanks. Thank you.
Lines on my neck.
Who would you rather? Are they?
They're gonna go down a lot. Welcome. Yeah. All right, thanks, Courtney. Appreciate it. You're a great model. Awesome. Yeah. You're set. Thank you. Excuse me. Yeah. Okay. Turn off the microphone. in a demo during the event. Doing like full face. No, I've done this before. No, I haven't like done a full face before because and bear with me because this kind of thing can take some time, and that's one of the reasons I haven't done it in an event because people have. I did the lips a few minutes ago, right? And as soon as I finished the lips and I was going to do the under eyes, everyone walked out. Like I don't know if attention span's short or something, but this is really cool because we're getting to do like a full face here, and I'm going to do. It's not going to be everything. I'm not doing her lips. Debbie has. How old are you now? You're like 63. She has amazing lips. Like they are so beautiful. But I did do them. I did inject them last year. Was it last year? And they were, and they still are, incredible. So we decided, you know, we're doing a lot of other stuff. We're not going to focus on the lips today. But I'm going to be doing chin and around the mouth. So we'll do marionettes. We'll do some pre-gel sulcus. We'll do nasolabial fold up in here. I'm going to do the under eyes like I did on Courtney a few minutes back. And then I'm going to do sort of like, you know, Debbie has some like really nice, some people call these the apples, like the central cheeks here. She's got some nice full apples. We don't need to do that. We need to supplement and augment some areas out here where she's lost fatty volume as she's aged. So we're going to take those areas subtly and enhance those areas. We can do smile lines. Yeah, and so it's going to be really fun.
Wait, I can't smile because my lips are all
Because your lips are all numb. Well,
But I'm smiling.
yeah, so I did dental blocks, you know, not just dental blocks, but facial blocks, and so basically from the mid face all the way down. And you can only block, and anytime you come to me, I can always do this. It's really easy, but you can only block the central face because the nerves come out of little holes called foramina, and there's another one up here, another two up here, supratrochlear and supraorbital, and so you can basically like numb the entire forehead up to the vertex. That's kind of cool right up here. But you can't get out in these areas because those nerves come in from the side and they come out of the spine, and you can't really block them in any real way. So, all right. Well, where should we start? I want to start doing some cheek. So, did I lose someone? Hi, Joy. I just love Chloe. I just love Chloe. She's still available? Oh, man. Did I lose? Hey, you know where Peyton went? Peyton, my nurse?
No. I'll find her.
She disappeared. Yeah, I want to get started. I need someone to help me. Yeah.
I'll find her.
Sorry, I'm just looking for Peyton. She's
She's a little debate.
lightheaded.
Yeah.
Yeah, or if she can. Go. Okay, so what I want to do is I want to get a little more fullness along the lower part of the cheek here and into this area below the cheekbone. We'll start out here. Once again, this is the cannula, blunt cannula. Come on. You just gotta wait for the little blood holes or else you can't see anything. There it is.
How you doing, boo-boo?
Oh, well, there was an area where I got a little lump there and I just went, and it just smoothed it right out. So I put 0.3 right across here. There was like a drop off, and now this is just like nice and smooth. This was really what I was going for. This whole cheek now just kind of curves just beautifully like that. So what I want to do now is there's this kind of drop off and hollow in here. So I want to take that and I want to fan and kind of smooth that out too. Is that the wrong one?
It is.
The thing I was talking about these fillers before, these RHA fillers, is that you can, because they move with the face so well and they stretch so well, you can put them like really superficially in the skin and they won't show up as a lump. Well, the nerve endings are in the skin itself. So theoretically, you go through the skin, you feel a pinch, and then when you're going underneath, you don't feel it as much. Now, there's in a sort of a way, I was scraping the underside of the dermis of the skin, so it might stimulate the skin and cause a little pain or a little achiness there. So didn't. Okay, so there you go. So look at that. So remember how much of a drop off and hollow there was there? So that's smoothed out there, and that was like that's a total of 0.6. I put a little more than half a syringe there. Okay, it's like not much at all. I think I'm gonna put a little bit more. So once again, you can put it so superficially, and what does that do? In the past, we injected really deep down on the bone, okay? When you're injecting really deep down on the bone, there's a lot of tissue over top of your filler. So what that means is you have to put a lot to make a difference. With this stuff, you're putting it superficially, so every bit that you're putting in shows. So like it makes it count, all right? All right, good. I love that. I would say about a year. When we start talking about like fillers lasting a year and a half, I think that's a little far-fetched, but you know, in some people it does. Some people filler lasts forever. That being said, there are some areas like the under eye region where filler can last 10 years. So without going away, but in a sense, it's like it's it's good and bad. Like it can come back in places where you don't want it to come back. Show it as a lump or something. But okay, so switch syringes and do the same thing on the other side. Okay.
Thank you. Drink that. It'll help.
So if we need Botox, do we call for an appointment? Okay.
Are you a patient here?
No, not okay. I've had it before. Oh, but I wasn't sure if like you guys were doing it tonight or if it was just a demo.
This is demo.
Yeah, it's just demos tonight.
Yep.
And then, yeah, make an appointment with one of
Okay,
us.
cool.
I remember our first event. A patient came up to me and she said, "I want to get my Botox." And I actually took her in a room and did it really quickly.
I wasn't sure if that
I
was
was like
a stupid
nuts.
question.
It was like completely nuts to do it that night. I was like, I can't even, like looking back, I can't even believe I did that because this is such a chaotic night. Beautiful, Debbie. It's looking great. What's that?
Every year it gets better.
Oh, thank you. Every year I say to Nikki, don't make me do demos again. Because they're like,
She's like, you're doing demos.
they're really stressful.
We tried.
Are they stressful?
Yeah, they're stressful. Like having to like perform, right? I mean, you
Yeah,
have to like, everything has to be done like, because I love this and it's something I'm good at and I enjoy it, but it's different doing it in front of a camera, in front of people with like time constraints, having to be able, having to talk while you're doing it, and then also like having to keep people's attention. So like I lost, like everyone walked out. Like the three of you guys are watching, but everyone else walked out, you know? So
They just went to get drinks and come back.
yeah.
I know. So then, when do you suggest a person get filler right here?
When you want filler there.
I feel like I look kind of wrinkly and I don't want to wake up tomorrow and be like, oh my god, you wrinkly hag.
I would I would say before you worry about filler, work on maintaining your skin quality, preserving your skin, and I would say get on our professional grade skincare program because dollar for dollar, it's your best buy in looking as well as you can and making your skin as healthy as possible. So I would go
My
that
skin's
way.
very dry, so.
It's not just dryness; it'll bring collagen to your skin. So I would say, and then if you want some icing on the cake, we can do a little filler there. But I would say work on the health of your skin before you just do filler. That's awesome. This is like, you should see how you look there. I mean, that is, I love that. I just love it. Okay.
Crazy.
All right, let me have that. Oh, that's, you have to switch them. Hold on to the cannula in case I need it. I want to resheathe that. Okay, so I got a little more of that.
I think you're doing a great job.
Thanks. Hey, you've been in here the whole time. Melissa.
You look good on this camera.
What happened to my? Oh, there you go. I need a 25 gauge introducer. See, now we're down to 2 people. And
She just went to go look at your skincare.
One's a support.
oh, did she?
You sent that to her.
Okay, okay, she's listening to me. Okay. All right, so I need you to sit up straight. I know it's not as relaxing of a position. Let's do this because I need the full effect of gravity. Oh,
I have two.
oh, you do now, huh? Okay. Just got a little bit of this left, so I wanted to use 4 in this area. All the way down. So now I'm using the redensity, which is what I used on Courtney's eyes a few minutes ago. Thinnest, stretchiest filler. Okay, so look how superficial I am there. Yeah, really. And Courtney's young, and so her skin was a lot thicker, so you couldn't do this. But this is what happens as you age; your skin thins out dramatically. And so, but with this filler, I can deposit this there, and it will not show up as a lump. It's the coolest thing. Yep. So look, see how this is a depression here, and here it's just nice smooth across. Now, I can't affect her skin because there's looseness in the skin, but it's still bolstered the skin underneath. Okay. Open your eyes now.
I don't have it. You took it. You threw it away. You didn't give it to me.
Got it.
I have everything else.
Okay, so now what do I need? I need this back.
I have 2 different parts.
I know you do. I'm going to take this one again,
There's 3 you can get out yet.
and then I need the brown hub. I need to get across here.
I'm good. Orange or black? No brown.
Orange.
He needs the brown one.
Pick a color, any color.
You gotta make that happen, Pete.
Wasn't even brown.
Oh. problem. Gotta get down deep. Come up underneath. So a little bit of RHA4 just goes a long way in bringing this up. Got a little depression there. Now the redensity again. Shoot, I'm oozing again. And there's this problem on film. It doesn't look great on TV when the patient's bleeding. All right. Can you edit out the blood, Perry?
That's what I can do.
Hey,
Well, hello.
how's it
There's free
going?
Botox in here.
Free Botox?
Not anymore.
Come on in.
You should have came earlier.
You're not gonna go home and sleep upside down again?
You know, Cindy's Tyson's mom.
I've known Cindy longer than you have.
We're like
We had the same birthday.
same age, same birthday. Like, I think I'm a few, but I was born 6 in the morning. You were born like a little later, right?
I don't know the birth certificate. Find
You
that
have to
out.
look that up. Yep, yeah, look it up.
Then we'll really know who's older.
That's right.
I just came to say hello.
Okay, look at that. I love it. Love it. Can you hold a little pressure on there, because that I'm gonna reload. Oh yeah, yeah, I'll do that. Okay, okay. This is like one of my favorite injections, the chin. Rest and define in the chin. So, and I'm even using it on label. Yeah, imagine that. Yeah. Okay. Because I was thinking Debbie would do great with chin.
I do really like chin filler.
Yeah. So it's projecting the chin forward, giving more prominence because you lose chin as you age. Second thing it's doing is it's narrowing the chin, making it look more feminine. And the third thing it's doing is it's tightening the skin across and giving it the jaw a more linear appearance. So that's pretty awesome too. It's dramatic how this can change someone's appearance.
Are we the same level?
That's awesome.
Oh wow. Oh wow.
What is it?
I love this. Just smile. Show them your smile right now. The full teeth.
Oh, okay, she's like, okay, so I wanted to do this area called the pre-jowl sulcus, which is, you know, you got like the jowls here, then in front of the jowls, what typically happens as you age is you kind of drop off here. And then there's also, along with that, there's this ligament here, and so it kind of accentuates that, and then also shows this little fossa here, which is the marionettes, right? So you can fill that area. So I'm gonna do it in 2 different places here.
She already has a beautiful uptick to her sides of her mouth.
That's not. I'm not really working on the sides of it, like the uptick thing. It's more the hollow in there. Yeah. You emphasize the beautiful uptick, right?
How long did you start to migrate at all? Did you get nausea at all? Say I'd like to go back and do it last time. Where's Rock? Nikki? Oh, we asked her.
Hi. Come here. You just spill on yourself. You just spill on yourself. Right. Should we stop us? Do you need a lot?
And this is all really superficial, which is the cool thing about this filler. It allows you to do that.
Is that quicker healing time?
Sorry?
Is that quicker healing time?
No, it's just where it's placed. It doesn't really change healing time necessarily. I don't think there's really healing with the filler. It's just that there's a certain amount of swelling that can occur around it, varying with the person. So I don't want to inject here. That's heavy. I want to inject right in front of it. Paid. Okay, so open your mouth.
I'm looking at this, I'm like,
So when I go like this,
it's a miracle.
smooth it out from both
You're
sides.
still there sometimes, like, oh my gosh, you're a miracle. It's a miracle. Just let it go.
Oh yeah, you're right.
It's okay,
We
somehow.
did it together. We raised each other.
Okay.
Get out of my brain. Go away. Get out of my brain. Just leave my. Love you. Enjoy. What's that? I need to get my eyes checked. Good. Good. Sometimes I feel.
Good. I think that's it.
Did you use this? Yeah, it's awesome.
Yeah, that's almost gone. See? Yeah, you were looking at the opposite.
I think I need to go to the eye doctor.
She went in a field.
Hey, going up there is I'm not trekking up there and get my car. Like I can't walk up there in heels. Put my heel Crocs on. Oh, I look white.
get that on video?
Oh my gosh. Thank you so much.
I think the lower face here is just like
It's amazing. My I can't
little
numbing.
little bruise right here, but that'll resolve. So hey Elijah.
Wow, the eyes.
I just did full face on her, and so yeah, I wish you'd been able to see her pre, but
You did?
we did RHA4 plus for density eyes. I did defined chin. I did RHA4 here. I didn't touch the NLF. I could have. I haven't done it. And then I just smoothed around like the cheeks.
How much product did you inject?
I used 3 syringes of RHA4 and like a redensity, and yeah, that was it. Oh, and then the define.
That's
Yeah.
amazing.
Yeah.
What do you think?
I'm glorious. Thank you.
You've been telling me that since I met you an hour ago.
I know. It was not bad. Guys, do it. And you're pro. Thank you.
Thanks for being my
Thank you so much.
model. Appreciate it. Yeah.
You can use this in your
Look really good.
I just can't talk right yet. That's good.
Yeah, maybe Deb, if we could get you back in a couple weeks, we can get some post pictures.
I'm here.
And by that time, yeah, and then everything will be like smoothed out and calmed down, and it'll be good. Yeah, because we got some good pictures last week, or no, 2 days ago, right? And when you came in. Yeah.
Hey, did you tell the doctor about how you knocked his penis off the counter?
You know, he's actually the one that did it, and he enjoys getting it for everything. But you're a youngster, so I'm not going to pick on
He does not. Oh.
Yeah.
He's a talker.
Yeah.
Oh. Okay, so remember you have to churn them. You have to get it all right. And have you done it with the connector thing?
No.
Yeah, this is the new way of doing it. Yeah, it's all mixed. So you put this on, and then you basically draw the 3 cc syringes out of that,
Out of it.
and then put the needle on it. Right. Oh, we need to clean her face, right?
You're going over there?
Okay, Sculptra. Last demo, Sculptra. Does anyone know what Sculptra is? Sculptra is it's an injectable, but it's not a filler. Fillers are like gels, they're hyaluronic acid mostly. They add volume. Sculptra is an injectable, but it's a biostimulator. So you inject it and it makes collagen. Okay, so it causes collagen to form via sort of this inflammatory reaction. So, yeah. Woo! She got gassed. She got gassed. So,
We got rid of them.
yeah, it's PLLA, which is fancy name for poly-L-lactic acid. It was first used in surgical suture and was found to stimulate collagen growth around the suture where the suture was added. It's an absorbable suture, so it would dissolve over time. And so it's not really ground up suture material. They actually take it and they make it into like a very, very precise, fine crystalline particle, like of a very precise size. So, and then what you do is you take it and you mix it with plain water, not saline for some reason, plain water in a suspension. So you can see it's cloudy. It can settle, so you got to keep moving it, because if it settles too much and it deposits unevenly in the skin, it can cause noduling, and that's the one possible side effect of having Sculptra is noduling. So it's really important after you inject it that the patient will rub their face to break up any deposits of that and disperse it. So I usually say 5 minutes, 5 times a day for 5 days.
Okay.
All right. So it's a controversial thing where and how to inject this. I think the current thinking is that you inject it superficially. We used to inject it deep, and there's not that there's anything wrong with injecting it deep, but when you inject it superficially, I think it just makes better use of the Sculptra. It's out there where you can see it more under the skin. So you can see I'm kind of making tunnels with the needle and depositing it below, fanning it out, so you can see that how it's not very deep. I mostly concentrate it in the lower face nowadays because a lot of people have a lot of laxity in the lower face, and it'll tighten the skin up really nicely. So, yeah, see. The problem with doing it this superficially, though, when you did it deep, it was very unlikely to bruise. It was pretty comfortable. When you do it superficially like this, you're kind of tickling the underside of the dermis. That's the deep layer of the skin. And that's where all the nerve endings are. So it can be a little more tender to do it this way. But I think it's really worth it because it gets the best effect of the filler. Can I have a sponge?
Yeah.
Not filler. It's not a filler. I made a mistake in what I said. So, all right. And when you inject it superficially, you can get it virtually to, you know, around the mouth, whereas you couldn't really do it previously. When we would inject it deep, you'd sometimes get into this muscle, that RBF muscle, and if you get in the muscle with Sculptra, you get nodulating, and it's not fun. But I'm injecting this so superficially, I'm not going to get in the muscle. Okay, so I'm going to get a little bit more in here. So I'm getting it like right under the skin in the corner of the mouth here.
Has she done this before?
Nope. You've never done Sculptra, have you?
No.
Okay, so, and then I want to directly treat the nasolabial fold, which is this crease right here. I'm going to go very superficially right into the fold to get some collagen in there. She might have a little bruise developing there. Down from the cheek. Sometimes I will actually put it down in here deep, but she's got such nicely developed cheeks, she doesn't need anything in there. I think accentuating that would be a waste of product. I am going to put a little bit more in the preauricular area, the area in front of the ear, which is an area where women frequently get volume loss. What do you mean? Yeah, I'm going, yeah, we'll make use of it. This has lidocaine in it, but it doesn't unfortunately numb you until after you've injected it, and then you have a numb face afterwards.
Is there any way you numb before?
You can do blocks like I did before. In the past, I've also numbed the entry points, the ports, like right here. I could numb that area. The thing though is it's like it's one stick, and when you numb it, it's one stick with lidocaine, which burns like crazy. So you're kind of numbing. You're numbing with one stick to do another stick.
Right.
So I don't know how much it really helps the situation.
Yeah, this side is on them. And this side's getting numb just from that first stick.
It's easier for the first couple pokes.
Mm-hmm.
You're doing really good. Have any of you ladies had Sculptra?
No?
No. Okay, right.
What was the question?
Has anyone had Sculptra?
Oh, no. Does it help with forehead wrinkles?
It's one of my favorite
Yeah.
things to do. Because a lot of what I like to do is natural rejuvenation, and Sculptra is like one of the best biostimulators. So.
Is there a certain age that you start
Um,
doing it, or?
Well, okay, so in your early 20s, like 18 to 20, you start actually losing collagen, all right? You lose 1 to 2% a year, like when you're really young, okay? You think you're not, but you are. It's just you don't realize it until you've lost a certain percentage. So when you get to be like in your mid 30s, it's when like, oh, I'm getting old, I can see the wrinkles, but you've actually been losing collagen for quite some time. Now, the problem is women compared to men. Women hit this thing called menopause, okay? Like usually in your early 50s, and then you double your collagen loss. So then you go from like 1 to 2% to like 2 to 3%, and that's why after menopause things like really accelerate and you notice big differences. So you can't do anything about that, but you can stockpile collagen and stimulate collagen along the way to maintain. So the more you have going into it, the more you'll have, the better advantage you'll have. And then if you continue with these treatments, you can maintain. It's a big feat just to maintain when you're losing 2 to 3% a year. So how people come to see me, women come to see me, and they'll be like, yeah, this is what I looked like 5 years ago. And they show me a picture, and it's like they look like a different person. And so they're at that stage where they're just losing a lot.
We can take some. This is some before and after pictures. But this is 6 vials. So typically first year is around 2 to 3 treatments, but you can see just huge differences. Very, very natural.
One treatment is a 2 vial kit, typically. The general rule, although it's not true for everyone, is 1 vial per decade of life. So 40 years old is 4 vials, 2 kits. Okay, so let's get the cannula on.
So typically the first year is, kind of it's nice because you're rebuilding all that lost collagen. But then once you get to kind of, you're okay, I'm good where I'm at. It's just like once a year. But it's
Sure.
No, once a year, just like probably 2.
Usually I split this, but I might not need to put this much in the temples. We'll see.
Right now. And then she'll
Okay,
probably need
so
2 to 3 treatments per year, or for the first year. And then after that, just
you can see like one place where you get a lot of volume loss is the temple. Okay. So I want to add some volume to the temple.
for treatment typically. And then typically kind of depending on what your first year, I'd say 2 to 3.
Can you take this needle?
Okay, and then after that.
And then after, and then you'll,
I need this 4 by 4 or 2 by 2.
we're good. We'll wait for a while.
I hit the
Probably after, and then
I hit the vessel,
indicated for 2 years.
the vessel.
And then after that, probably just once a year. Yeah. So, yeah.
You didn't get that on film, right? Yeah, maybe you did. We can edit it out.
Come back and about 2 months later, do 2 more. Then maybe about
Okay.
4 months later,
So anyway.
do 2 more. And then she probably she might need 1 more treatment, but she'll probably be good. So good for a while, and then yeah. I mean, yeah. So she's 42. She's had 4 vials. So I mean, it's very natural. So there's a lot of water being injected today, so you can get pretty. It's almost like a little preview of what it will look like, but you also can get pretty swollen. So you just wouldn't want to do that's a low scaldra, and you do want to space it out. Yeah. And you also might wait to come back in, 3 months, 6 months, and be like, actually, you only need one vial, or actually, hey, you do need two. So you kind of want to make a assess and see what your skin's gonna do. Yeah.
I don't think I can put that much in the temples, so
Yeah, and as we age, we tend to get pretty hollow.
I don't think I can put more than a half a syringe at this point. Have you introduced her here on this side? Yeah, yeah. Well, I'll figure out where to put it.
When you start with the 2 vials, you get it a little bit all over.
So not in the forehead, and then just kind of right here and throughout the hair. But it's FDA preferred for tighter jawline and higher cheekbones, and then a glow. And then it originally was designed for HIV patients because they tend to get pretty hollow. And Dr. Rock saw what it was doing and they bought it for aesthetics. But it's still being used for HIV.
What's that?
So all that works with drugs at HIV.
You can?
Yeah.
Can you check the other side and see if she's bleeding?
Yeah.
Wow.
Sorry, we'll get that.
No, that's okay. Mop up on aisle 3.
Uh-huh.
Yeah, this side is
So it's
fine.
not new to, just new to aesthetics.
Yeah, okay. It's a lot more watching it than what I thought it was going to be as far as how far that needle is in there.
And she can, you're young too, so.
That's why watching it is a lot more dramatic than getting it, I think.
Right.
I agree with that. That's
Yeah.
why I sat under the TV.
That's like when you got threads.
Yeah.
Watching threads is like brutal.
Yeah.
It's like
I did my threads, and then my best friend did hers the next day, and I held her hand, and I was like looking at the wall. I'm like, oh.
And then we did a road trip, and everybody thought I beat up my wife. That's true.
Because when you get Botox, it's just more of like a prick, right? It's not going.
Yeah, this is
it's very superficial.
very superficial. This is pretty deep because you're going down to rebuild that lost collagen.
I think we'll just leave it as is. We don't need that. Yeah. That's it.
It's fast.
Yeah. And that took longer than average because I was talking and kind of stuff. So, yeah. So then we it's not really over yet because we have to, it's important to do this massaging thing, and we always do this afterwards. So, and then she goes home and she continues at 5 minutes 5 times a day for 5 days, but just like a circular motion, and it takes all the particles and it disperses them.
Are you watching, Paul?
Yeah. I won't have my certificate. Not yet.
And this is the part I have Anna do normally, my esthetician. So.
And you can't put that in the crease. I think somebody asked that too, in the forehead.
What's that?
You can't put that in the forehead creases. I heard someone ask that.
No, you don't typically do that. You can't really put it around very active muscles because, well, and then these muscles are right below the skin, and so there's no way you can kind of get them into that area where you're not getting them in the muscles, because what'll happen is you get all sorts of noduling in there. So you can't put it around the eyes. You can't really put it around the mouth. You can sort of get it in here because there is some subcutaneous fat in there that'll separate the muscle.
I like the part that it's natural.
Yep. You have this little particle, and the particle gets eaten up by the body and spit out, and then it's gone, and it's all your collagen only. Okay.
And then you'll want to massage as much as you can for the next 5 days. So especially if you're driving in the car when you have to do your skincare. And then try to massage up if you can. So
Yeah.
you want to go, bring it down. Right, try to lift up.
A little bruise here.
It's easy. You know that. Even my Monica.
You did great.
Well, I was injecting a lady a couple weeks ago, and in the process, she's like, every time I stuck a needle, she gushed. I was like, "What have you been taking?" It turned out she had a bad headache and she was taking like high dose aspirin, like probably upwards of like 3,000 a day, which you will never stop bleeding. You know, like a baby aspirin's 81 milligrams, and that so that was why, and she got totally bruised. But
So will she be bruised tomorrow?
she might have a little bruising there, a little bit. I don't think so. I don't think so. You can kind of see where it's going to be. Yeah. Okay. Very good.
And I took my arnica, so I'll take it again tomorrow.
Yeah.
What is it? Arnica? Does that help with bruising? Yeah. And then have cranium too.
Thanks for letting me do that.
It's okay. Well done. Wow.
Yeah.
Thank you, Ben.
Good job.
Good job.